Good morning, everyone. Our topic for today is about Autism Spectrum Disorder or ASD. ASD or Autism Spectrum Disorder is a developmental disability that can cause significant communication and behavioral challenges. There is often nothing about how people with ASD look that sets them apart from other people, but people with ASD may communicate interests, behaves others. The learning, thinking, and problem-solving abilities of people of ASD can range from gifted to severely challenged. Some people with ASD need a lot of help in their daily lives, others needs less. A diagnosis of ASD now includes several conditions that used to be diagnosed separately. Autistic disorder, pervasive developmental disorder, not otherwise specific, PDD, NOS, and Asperger syndrome. These conditions are now all called autism spectrum disorder. Let's move on to the signs and symptoms of ASD. People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not change in their daily activities. Many people with ASD also have different ways of learning, paying attention, or reacting things. Of ASD begin during early childhood and typically last throughout a person's life. Children or adults with ASD might not point out of objects to show interest, not look up objects when another person's point at the have a trouble relating to others or not have an interest in other people at all. Avoid eye contact and want to be alone. Have trouble in understanding other people's feelings. Prefers not to be held or cuddled or might cuddled only when they want to. Appear to be unaware people talk to them but respond to others' sounds. Be very interested in people but not how to talk, play, relate to them. Repeat or echo words or phrases said to them, or repeat words or phrases in place of normal language. Have trouble expressing their needs using typical words or motion. Not play pretend games. Repeat action over and over again. Have a trouble adapting with a routine. Have unusual reactions to the way things smell, taste, look, feel, or sound. Lose skills they once had. Let's move forward to the symptoms of ASD. Hyperactivity or very active. Impulsivity, action without thinking. Short attention span. Aggression. Temper tantrums. Unusual eating and sleeping habits. Unusual mood or emotional reactions. Lack of fear or more than expected. Unusual reaction to the way things sound, smell, taste, look, or feel. People with ASD might unusual responses to touch, smell, sound, sight, and taste and feel. For example, they might over or under have might they have abnormal eating habits. For instance, some people with ASD limit their diet to only a few foods. Others might eat non-foods items like dirt or rocks. This is called pica. They might also have issues like chronic constipation or diarrhea. People with ASD might have odd sleeping habits. They also might have abnormal moods or emotional for reactions. For instance, they might laugh or cry or unusual in times you would expect one. In addition, they might not be afraid of dangerous things, and they could be fearful of harmful less objects or events.
The diagnosis. Diagnosing ASD can be difficult since there is no medical test, like a blood test to diagnose to the disorder. Doctor look at the child behavior and development to make a diagnosis. Sometimes ASD can be detected at 18 months old or younger. By the age of 2, a diagnosis by an experienced professional can be considered very reliable. However, many children do not receive a final diagnosis until much older, and some people are not diagnosed until they are old. Children with ASD become adolescents and young adults. They might have difficult developing and maintaining friendship, communicating with peers and adults, or understanding what behavior are expected in school or on the job. They may also come to the attention of healthcare providers because they have co-occurring. In this case, ang mga bata na nagkakaroon ng ASD is um, they have difficulties in developing and maintaining friendship and sa pagko-communicate din sa ibang tao. Several step and process which is kagayang sinabi ko, monitoring, evaluating, screening, and diagnosis. Yung nauna kanina is diagnosis and pangalawa is developmental monitoring. It observe how your child grows and change over time and whether your child's meet the typical development milestone in playing, learning, speaking, behaving, and moving. Parents, grandparents, early childhood providers, and other caregivers can participate in the developmental monitoring. In developmental monitoring is dito na monitor yung mga how a child move, play, learn, speak, behave, and others with the help of family member and also peers and the one who your child encounter and engage. Developmental screening. It takes a closer look at how your child is developing. Your child will get a brief of test or you will complete a questionnaire about your child. Dito, sa developmental screening is bibigyan yung mga anak or yung batang may ASD test which is pwedeng questionnaire, pwede ding checklist kung saan ito ay nagagamit for measure the developmental and behavioral of every child that has an ASD. Is comprehensive development evaluation. It is a brief test using a screening tool, does not provide a diagnosis, but it indicates if a child is on the development track or if a specialist should take a closer look. If the screening tool identifies an area of concern, a formal developmental evaluation may be needed. This formal evaluation is a more deep look at a child's development, usually done by a trained specialist such as developmental pediatrician, child psychologist, speak language pathologists, occupational therapists, and other specialists. Is treatment. There is currently no cure for ASD. However, the research shows that early intervention treatment services can improve a child development. 2 to 3 early intervention services help children from birth to 3 years old or 36 months to learn important skills. Services can include therapy to help the child talk, walk, and interact with others. Therefore, it is important to talk to your child doctor as soon as possible if you think your child has ASD or other developmental problem. So, dito sa treatment is, dito sinasabi on how a child has ASD, how to kung paano binibigyan ng treatment, which is it include the therapies on how a child walk, talk, and interact to others. Types of treatments, which is it is generally can be broken down into the following categories, which is behavior and communication approaches, dietary approaches, medication, complementary and alternative medicine. Sa behavior and communication approaches, it is categorized in applied behavior analysis, which is known as ABA. It is a notable treatment approach for people with ASD. Is called applied behavior analysis. Has become widely accepted among healthcare professionals and used in many school and treatment in every clinic. There are different types of ABA, which is DTT, or also known as discrete trial training, which is it is a style of teaching that uses a series of trials to teach each step of a desired behavior or response. This is the early intensive behavioral intervention, which is this is type of ABA for very young children with ASD, usually younger than 5 and often younger than 3. EIBI uses a highly structured teaching approach to build positive behavior such as social communication and reduce unwanted behavior such as aggression and self-injure. Is Early Start Denver Model or ESDM. This is a type of ABA for children with a ASD between the age of 12 to 48 months. Through ESDM, parents and therapists use play and joint activities to help children advance their social language and cognitive skill. Sa pamamagitan nito, mas nakakatulong ito for children with ASD to to join or do some activities like social activities and also some knowledge in social language and cognitive skills. Pivotal response training or PRT. It aims to increase a child motivation to learn, monitor their own behavior and initiate communication with others. Dito naman dito pinupush yung batang may ASD to learn and initiate communication with others. And then dito sa pivotal response training, positive change in this behavior are believed to have widespread effect on other behaviors. So next is the verbal behavior intervention or VBI. It is a type of ABA that focuses on teaching verbal skill. Dito sa verbal behavior intervention, it helped those children that has a ASD to learn in verbal skills like in communicating and other verbal skills that they need to learn. There are other therapies that can be part of a complete treatment program for a child with ASD. Number one is assistive technology. Assistive technology includes devices such as communication board, an electronic tablet. It can help people with ASD communicate and interact with others. Through this assistive technology, they can communicate and interact with others through these devices. Occupational therapy teach skills that help the person live as independently as possible. Skills may include the dressing, eating, bathing, and relating to the people. Dito sa occupational therapy, natuturuan sila on how to be independent as they can. So next is speech therapy. It helps to improve the person communication skill. Some people are able to learn verbal communication skill. For others, using gesture or picture boards is more realistic. So dito sa speech therapy, nakakatulong ito to improve person's communication skills, which is through verbal communication and nonverbal communication. Let's proceed to the second types of treatment, which is dietary approaches. Some dietary treatment have been developed to address ASD symptoms. However, a 27 systematic review of 19 randomized control trials found little evidence to support the use of dietary treatment for children with ASD. Some biomedical intervention call for changes in diet, such as change can include removing certain food from a child diet and using vitamin or mineral supplement. Dietary treatment are based on the idea that food allergies or lack of vitamins and minerals using symptoms of ASD. So let's proceed to the third types of treatment, which is medication, which says that there is no medication that can cure ASD or treat the core symptom of ASD. However, there are medication that can help some people with ASD function better. The last type of treatment is complementary and alternative medical treatment, which is it can help to relieve the symptom of ASD. Some parents and healthcare professionals use this treatment that are outside of what is typically recommended by pediatrician. These treatments are known as complementary and alternative medicine treatment. Dito yung mga iba't ibang pwedeng i-alternative medicine for uh, alternative medicine treatment for those child that has an ASD. Proceed to the causes and risk factor of ASD. We do not all know of the causes of ASD. However, we have learned that there are like many causes for multiple types of ASD. There are many different factors that makes a child more likely to have an ASD, including environmental, biologic, and genetic factor. The scientists agree that genes are one of the risk factor that can make a person more likely to develop ASD, which is kung it says that um, genes is the one risk factor that a child or person can makuha or makakaroon ng ASD. Children who have a sibling with ASD are at a higher risk of all having ASD. Individual with certain genetic or chromosomal condition such as a Fragile X syndrome or tuberous sclerosis can have a greater chance of having ASD. When taken during pregnancy, the prescription drug valproic acid and thalidomide have been linked with a higher risk of ASD. Yung valproic acid and thalidomide is nagbibigay din ng higher risk for ASD. As ASD continues to be an important public health concern, like the families living with ASD want to find out what causes the disorder, which is understanding the factor that make a person more likely to develop ASD, which will help us learn more about the causes.
Good morning sa ating lahat. I'm here to explain the Autism Spectrum Disorder or ASD treatments. So first, what is ASD treatment? ASD has no treatment, but there are several interventions that may reduce the symptoms, improve cognitive ability, and daily living skills. So, ibig sabihin dito, ang ASD ay wala pong treatment or any medication. Pero, merong mga several na intervention or mga remedies na pwedeng gawin para ma-reduce yung mga symptoms, tapos mag-improve yung cognitive ability nila sa pang-araw-araw. There are differences in how ASD have unique strength and challenges in social communication, behavior, and cognitive ability. Treatment plans are usually multidisciplinary. It may involve parent-mediated intervention to target the child's individual needs. So, ibig sabihin dito, magkakaiba yung pag-handle ng ASD. Merong mga unique na strategies, tsaka kung paano nila ito i-disciplinary. So, treatment plan has a multidisciplinary. Ibig sabihin, marami siyang disciplinaries na pwedeng gamitin. It may involve, yun nga sabi kanina, parent-mediated intervention. So, it means ito, mas magfo-focus dun sa parent and child relationship para mas maging yung target ng child's individual needs ay ma-meet. So, sa behavioral intervention naman tayo. Behavioral intervention, it focuses on social communication skill development in young age when the child would naturally be gaining these skills, reduction of restricted interest, and repetitive and challenging behavior. Ang behavioral intervention, nagpo-focus siya sa social communication skill development. So, it means ito yung pakikipag-usap sa maraming tao. In young age, when the child would naturally be gaining these skills, reduction and restricted interest and repetitive challenging behavior, dito, mapapakita dito na yung makaka-gain siya, tsaka mawawalan siya ng interest sa mga nire-restrict sa kanya ng paulit-ulit. So, dun nagkakos yung behavioral change. Occupational and speech therapy may be helpful, social skill training and medication in older children. So, dito, kapag mga medyo may edad ng mga bata, ang ginagawa is meron tayong speech therapy na nakakatulong sa kanya. Children with ASD, regular medical and dental exam should be part of child's treatment plan. So, yung mga may ASD, lagi dapat na regular medical and dental exam para maging part na siya ng treatment plan nila. Next dito tayo sa types of, meron tayong mga types of treatments dito. 4 yon. Ito ang behavioral and communication approaches, dietary approaches, medication, tas complementary and alternative medicine. So, first punta tayo sa behavioral and communication approaches. Sa behavioral and communication approaches, American Academy of Pediatrics and National Research Council, behavior and communication approaches that helps children with ASD are those that provide structure, direction, and organization for the child in addition to family participation. So, it means dito, ang American Academy, ibig sabihin dito, may isang American Academy of Pediatrics and National Research Council ang nagbuo ng mga concept ng treatment sa behavioral and communication approach. Meron tayo ditong behavioral and communication. Sa behavioral and communication, meron tayo ditong mga types niya. Una ay ang Applied Behavior Analysis or ABA. A widely accepted among healthcare professionals and used in many schools and treatment clinics. It encourages positive behavior and discourages negative behavior to improve a variety of skills that the child's progress is tracked and measured. So dito, ina-accept ito ng healthcare professionals to use sa many schools na o mga treatment clinics para mas ma-encourage sila na mas na-encourage nila yung positive behavior, tapos binabaliwala ay dinidiscourage nila yung negative behavior para mag-improve yung isang child. At yung child's progress is laging nakatrack at na-measure. Meron tayong different types of ABA. Ito ang Discrete Trial Training or DTT. Style of teaching that uses a series of trials to teach each step of desired behavior or response. Lessons are simple. It is use positive reinforcement toward correct answer and behavior. Incorrect answer are ignored. So, dito sa DTT, ito yung pinaka-style of teaching na napaka-simple. Lahat ng lesson ay napaka-simple. Ang ginagamit lang dito ay laging positive. Hindi nila positive lagi ang pinapakita sa mga or reward sa mga children na may SD para yung behavior nila is mas maging triggered na laging positive. Tapos ang mga incorrect answers ay laging ini-ignore para hindi na maging discrete pa or maiba yung behavior ng bata. EIBI. So, let's proceed to Early Intensive Behavioral Intervention or EIBI. Itong intervention naman na to at very young children with ASD, usually younger than 5 and often younger than 3, uses highly structured teaching approach to build positive behavior and reduce unwanted behavior. It is a one-on-one adult to child. So, it means dito, mas nagfo-focus sa one-on-one na pakikipag-usap and kung saan dito masasabi na laging nagbi-build up yung one-on-one na parang pag-uusap nila or ito yung watch teaching ng adult to child teaching sa mga mas bata, ganun. Punta naman tayo sa Early Start Denver Model or ESMD. Children between the ages of 12 to 48 months, parents and therapists use plan and joint activity to help children advance their social, language, and cognitive skills. So, dito sa ESMD, yung mga baby pa lang siya, or 1 year old to 2 years old, 1 to 3 years old pala, nag-produce sila ng, yung parents tapos yung therapist, gumagawa sila ng plan para makatulong dun sa bata paglaki na niya para mas ma-improve yung social language and cognitive skills niya. Sa pivotal response training naman tayo or PRT, increases a child's motivation to learn, monitor their own behavior, and initiate communication with others. Their positive changes is their behavior. So dito naman ang parang punto naman ito is yung motivation ng isang bata is mas tumataas para mas magkaroon ng positive changes sa behavior. Verbal Behavior Intervention or VBI. Ito sa VBI naman nagpo-focus siya sa teaching skills ng verbal. So, yon. Tapos, ito yung mga therapists ito yung mga therapists na pwedeng maging part ng treatment program. Assistive technology. Dito sa assistive technology, nag-i-include siya ng communication boards and electronic tablets. Can help people with ASD communicate and interact with others. Exchange Communication System or PECS is used doon makikita na dito yung sa assistive technology gumagamit ng tablets, electronics, yung mga ibang mga technologies. And yung exchange communication system is nag-produce sila ng PECS para makagamit ng picture symbols para doon magkaroon ng conversation. Developmental Individual Difference Relationship-Based Approach. Ito, Developmental Individual Difference Relationship-Based Approach, ito ay isa rin sa therapist na magiging part ng treatment program. Ito yung floor time. It focuses on emotional and relational development. So, ang pagde-develop, ang pinofocus naman na development nito is yung pagde-develop sa relationship saka sa emotional. Occupational therapy teaches skills that help the person live as independently as possible. Occupational therapy, ito yung nagtuturo, tinuturoan siya ng skills that help person live as independently as possible. So dito, parang tinuturoan niya yung isang bata para mag-live siya ng independently sa kanyang sarili. Social skills training teaches children the skill they need to interact with others, including conversation and problem-solving skills. So dito, ang tinuturo naman nito, ito yung paano sila makiki-interact para makapag-conjoin ng conversation at makapag-problem-solving. Speech therapies, ito is, sinabi ko kanina na isa sa pwedeng maging therapy or treatment para sa kanila, improve personal communication skills. So, sinabi natin, speech therapy, it means dito sa pananalita nila para makapag-communicate sila ng maayos. Punta naman tayo sa treatment rin na dietary approach. Ito ay isa rin sa mga pwedeng treatment na sinabi ko kanina. In 2017, systematic review of 19 randomized controlled trials found little evidence to support the use of dietary treatment for children with ASD. It is called for a change in diet. It includes removing certain food from a child's diet and using a vitamin or mineral supplement. It is based on the idea of food allergies or lack of vitamin and mineral cause symptoms of ASD. So, ibig sabihin dito, sa dietary approach, pinapakita dito na isa sa mga therapy niya is magpapalitan nila yung diet ng bata para malaman kung ano yung pwede maging approach nila doon sa bagay na yon, nang hindi magkaroon ng pagkukulang sa mga vitamins or minerals. Magtatanggal sila ng food and papalitan nila ito ng vitamins and mineral na kailangan niya para hindi mag-kickback yung nasabi na para hindi mag-kickback yung symptoms, para para hindi mag-cause yung symptoms ng ASD. Sa medication na tayo, there is no medication that can cure ASD or treat the core symptoms. There are medications that can help some people with ASD functions better. Medications might not affect all children in the same way. It is important to work with a healthcare professional who has experience in treating children with ASD. Parents and healthcare professionals must closely monitor a child's progress and reaction while they are taking medication. So, ibig sabihin dito sa medication, wala nga pong kahit anong medication na pwede mag-cure ng ASD. Pero, merong mga treatment na pwede makatulong sa kanila para yung cause ng ASD is medyo mas malimit or mas makakapag meron tayong mga treatment na pwedeng makatulong sa kanila to overcome or makatulong para hindi na masyado ganun na mag-conquer yung ASD nila. Complementary and alternative medicine treatment naman tayo. Some parent and healthcare professionals use treatment that are outside of what is typically recommended by pediatricians. Refers to the product or services that are used in addition to or instead of traditional medicine. So dito, diba sabi ko kanina, yung mga parents and mga therapists, nag-uusap sila with the pediatrician para magtulong-tulong sila to overcome and para mailampas nila yung level ng treatment. That's all. Thank you.